Hi everyone, welcome to yet another Woodhouse Healthcare Live. Happy to be back uh, for another live session. Just waiting for a couple of people to at least start joining in. All right, great. I can already see a couple of people have already joined the session, which is great. Hi, welcome. Okay, great. I can see many of you are joining in already, which is quite fast. क्योंकि usually थोड़ा time लगता है for people to warm up and join the session. So this is really nice. Before I start talking and we begin the session, can you just give me maybe a thumbs up if you can see me, if you can hear me properly, मेरी आवाज़ clear आ रही है कि नहीं? It's good for me to know. So any of you, if you can just give me a thumbs up if you can hear me, and if not, तो I will try to adjust my phone. Are you able to hear me well? Okay, perfect. Thank you for that response. And I would appreciate it कि आप इतने ही responsive हो in the session as well, because it's good for you to utilize the platform. To be honest, आज का topic काफ़ी sensitive है, yet a very very important topic to talk about. We believe कि miscarriages इतने frequent नहीं होता है या इतने ज़्यादा लोगों को नहीं होता है, but that would be a wrong assumption because you're not alone. You have a lot of people who are going through the same difficulties as you are, and in fact जब हमने question put out किया था, a lot of people and we got a really overwhelming response in terms of the questions that people poured in to our DMs. तो मैंने वो सारे questions भी यहाँ पे note down करके रखे हुए हैं. So when our session begins with our doctor, I'm going to address all of those questions with them as well. Great, I can already, I think you can. Okay. So I can already see a lot of you have joined in, so it's a good time to begin the session. Because it's an interactive session, I am going to open the platform for the last 15 minutes to address all of your questions. We're going to try to address as many questions as we can, hopefully all of your questions. तो राइट हैंड साइड बॉटम कॉर्नर में आपको एक क्वेश्चन मार्क दिखेगा. आप वहाँ पे अपने सारे क्वेश्चंस डाल सकते हो, एंड इट्स जस्ट ईजियर फॉर मी टू एक्सेस ऑल योर क्वेश्चंस इन वन प्लेस. इसलिए मैं बोल रही हूँ क्वेश्चन मार्क वाले सेक्शन में डालने के लिए. But if you're not able to find that section, you can always just write your question in the comment below, and I will try to address it from there as well. And I'll try to get the question, reach the doctor and ask them. So yes, before we actually begin the session, let me start by introducing what we do, what this platform is. Woodhouse Healthcare is an online virtual fertility platform जहाँ पे हम men and women के reproductive health related issues, hormonal concerns and fertility related concerns को address करते हैं. We provide online consultations. We do a lot of activities around the topic so that we are able to help more and more people. We obviously organize these kind of live sessions every month, first Friday and last Friday of every month at 5 p.m. So कभी भी आप देखो, अगर आपके इशू से रिलेटेड कोई टॉपिक है जिसमें हम लाइव कर रहे हैं, डू जॉइन इन, आस्क योर क्वेश्चंस. एंड अगर आपको लगता है दैट you know somebody who has the same problem that we're going to address in the next live, तो please आप उनसे share करो. And if you have some topics that you want us to talk about, please send us a DM, and we will try to make a list and address it every single month. 2 or 3 sessions per month. तो आप हमेशा join करके अपने problems पूछ सकते हो. And when we're talking about reproductive health, fertility issues and all of that, it from PCOS related infertility problems to some male fertility factors, semen में issues हो, चाहे fibroids हो, endometriosis हो, miscarriages हो जिसके बारे में आज हम लोग बात करेंगे, चाहे वो uterine abnormalities हो, ऐसे बहुत सारे topics हैं. या बस आप कंसीव करने की कोशिश कर रहे हो एंड you're just struggling to conceive, and that in itself is already a painful journey. So we try to do a gamut of things so that we can help any kind of person who is trying to conceive and it's difficult for them, to help them out. इसके अलावा वेरी सून वी आर ऑल्सो गोइंग टू लॉन्च अ प्रोग्राम. इट्स कॉल्ड माई फर्टिलिटी साथी. दिस इज स्पेसिफिकली फॉर women who are undergoing PCOS and are struggling to conceive. The whole idea is to provide them end-to-end services with all kinds of medical guidance, understanding of the medical interventions that they need to go through to be able to ovulate, tracking their cycle, helping them understand when they're ovulating, and then giving you the medical guidance, but also the emotional and mental support and lifestyle modification that you need to make in order to be able to make it a successful journey. And during this 6 months program, the whole aim is that by the end of the program, you are able to conceive. More about this program later, of course, so stay tuned to the page if you want to know more about the program and you want more content on the topics that you want us to talk about. आज के सेशन में हम बात कर रहे हैं मल्टीपल मिसकैरेजेस या रेकरेंट प्रेगनेंसी लॉस के बारे में. अगर आपके पास ऑलरेडी क्वेश्चंस हैं, जो कि आई कैन ऑलरेडी सी 3-4 पीपल हैव ऑलरेडी सेंट इन देयर क्वेश्चंस, सो थैंक यू सो मच. आई नो कि ये टॉपिक बहुत ही सेंसिटिव है, तो आई विल ट्राई टू कीप योर नेम्स अनोनिमस एंड आई विल आस्क द क्वेश्चंस. तो आप बेझिझक अपने सवाल हमसे पूछ सकते हो, एंड इट कुड बी रियली पर्सनल एज वेल, and we're going to try to address as many as we can. Now, I would just like to invite Dr. Shraddha very topic straight away. We can make it as interactive as you want. अगर आपके पास questions हैं, आप questions डाल सकते हो. Hi, Dr. Shraddha. Welcome
Hi,
to the...
Isha.
Hi.
Thank you for inviting me.
Of course, आपने अपने busy schedule में से time निकाला, so we appreciate that. आप कैसे हो?
All good. How about you?
Yeah, all good. Thank you.
Okay.
तो डॉक्टर श्रद्धा, आज का टॉपिक काफी सेंसिटिव है बट बहुत इम्पोर्टेंट है, बिकॉज क्लियरली बहुत सारे लोग आर गोइंग थ्रू दीज डिफिकल्टीज एंड इट्स नॉट जस्ट फिजिकली बट ऑल्सो इमोशनली चैलेंजिंग.
Yeah,
तो let's try together to help as many people as we can today in the session,
sure.
and hopefully it's fruitful for everyone who's turned up for the session.
Sure. Yeah.
Okay, before we begin the session, let me just quickly introduce you. Dr. Shraddha is an obstetrician, a gynecologist, a laparoscopic surgeon, and a reproductive medicine specialist. आपने around 5 years as infertility consultant काम किया है, and you've helped like a lot of people, consulted with a lot of people, helped them conceive. So welcome to the live session today again, Shraddha, and if you're ready to dive in, let's just quickly jump into it.
Thank you so much. And I'm ready. Let's go ahead.
Okay. Perfect. Thank you. So, Shraddha, I'm really happy to see that a lot of people have joined in. That means कि एक topic है जिसके बारे में और ज़्यादा बात करनी चाहिए. It's such a hush topic, which is understandable because it's such a personal journey that people go through. But कैसे पता चलेगा? कोई एक प्लेटफॉर्म होना चाहिए जहाँ पे आके वो कुछ बात कर सके, अपनी प्रॉब्लम शेयर कर सके. तो I'm glad that we are able to provide that platform to people, and कुछ सवाल हमारे पास पहले से आए हैं, कुछ सवाल अभी आ रहे हैं. So let's just go ahead with this.
Sure.
Shraddha, let me start with a very simple basic question.
Okay.
कि miscarriage को कैसे define करते हैं? How do you define miscarriage? What happens in a miscarriage?
So the miscarriage is just like a pregnancy loss.
Mm-hmm.
Okay. So before the 5th month, that means 20 weeks in our medical language.
Yeah.
Okay. So 20 weeks से पहले अगर pregnancy loss हो रहा है, then that is called as miscarriage. And
Right.
abortion and miscarriage is also same. So
Okay.
it's a new word for the abortion.
Okay. So interchangeably use कर सकते हो. Even during the session today, you probably might use both the words on and
Yeah,
off.
exactly.
Basically the same.
Exactly.
Okay. Okay. So जब when we talk about miscarriage in general and not recurrent pregnancy loss, उसके कुछ common causes क्या होते हैं? And is it कि common like one time miscarriage versus recurrent pregnancy loss के बीच में कुछ difference है in terms of causes and what it means?
या वन टाइम मिसकैरेज के लिए ओनली मिनिमल रीजंस होता है बेसिकली, एंड रिकरेंट मिसकैरेजेस के लिए बहुत ज्यादा रीजन होता है बेसिकली. सो फॉर द फर्स्ट टाइम वी विल एवेल्युएट टिल वन एक्सटेंट, एंड सेकंड इन्वेजिव इन्वेस्टिगेशंस या जो भी है और कुछ आगे बढ़ते हैं रिकरेंट मिसकैरेजेस में. So both of them have the proper normal protocol of evaluation.
Hmm.
So we can start with the uterine evaluation, tubes evaluation, and ovarian evaluation.
Hmm.
So and the fetal baby evaluation, genetic analysis of the baby.
Hmm.
So that's the most common we can see in the miscarriage loss. Yeah, miscarriage causes.
Right. तो what you talked about right now was like क्या हम चेक कर सकते हैं यूट्राइन के abnormalities और ये सारी चीजें, बट एक्चुअल अगर हम थोड़े लेमैन टर्म्स में बात करना चाहें तो उसके क्या कॉजेज हो सकते हैं, लाइक इफ वी define it in terms of causes rather than in terms of what we can do to detect.
ओके, सो फर्स्ट कमिंग टू द मैटरनल कॉजेस.
हम्म.
मतलब जो भी वुमेन अगर रिकरेंट मिसकैरेज से आते हैं या जो भी एक वन हिस्ट्री ऑफ अबॉर्शन के साथ आते हैं,
हम्म.
तो विल जस्ट स्टार्ट विथ एवरी बेसिक इन्वेस्टिगेशंस. फर्स्ट हमको चेक करना पड़ता है कि हार्मोनल एवेल्युएशन, ठीक है, थायराइड उसमें आ जाता है कि थायराइड, प्रोलैक्टिन लेवल्स, एवरीथिंग इज वेरी इंपॉर्टेंट इन मिसकैरेज एवेल्युएशन. एंड जो आता है नेक्स्ट, सोनोग्राफी.
हम्म.
सो यू ट्राइन जो गर्भाशय जो होता है उसमें फाइब्रॉइड्स रह सकता है,
हम्म.
या जो भी परत रह सकता है, या इन्फेक्शन रह सकता है, जो भी रहता है, तो हमको अल्ट्रासाउंड से हमको एवेल्युएशन करना पड़ेगा.
हम्म.
सो एंड ओवेरियन एवेल्युएशन ऑल्सो. नाउअडेज वी सी मोस्ट ऑफ द पीसीओएस पेशेंट्स.
हम्म.
तो उसमें एक चीज होता है कि ल्यूटियल फेज डिफेक्ट,
ओके.
जिसमें प्रोजेस्टेरॉन का सपोर्ट बहुत कम होता है. तो उसमें सिंपल प्रोजेस्टेरॉन सपोर्ट से हम मिसकैरेज को हम रुक सकते हैं.
हम्म.
So the PCOS also is evaluated on the scan. All
राइट.
right. So main thing comes with the genetic analysis.
हम्म.
तो जब सेल डिवीजन होता है ना गैमेट की प्रोसेस में, तो उसमें क्रोमोसोमल जो डिवीजन होता है वो अबनॉर्मल होता
हम्म.
है. किसी का एक ज्यादा मिलता है, किसी का कम मिलता है, स्पर्म या ओवम में भी.
हम्म.
So that we can do with the genetic analysis also. They are very आजकल like we got many fish बोल के और NGHS बोल के. So
हम्म.
cytogenetic analysis tests have been
हम्म.
in the market. So we can just find out the chromosomal analysis of the baby also.
ओके. ओके. तो
Yeah.
आपने भी मेंशन किया, काफी सारे कॉजेज मेंशन किए हैं जो हो
Mm,
सकते हैं. उनमें से
yeah.
आई ऑलरेडी वांटेड टू आस्क अ फ्यू क्वेश्चंस अबाउट दीज थिंग्स एज वेल, बट आपने ऑलरेडी एड्रेस कर दिया उनको.
Mm,
तो जैसे हार्मोनल इम्बैलेंसेस वगैरह होते हैं, अब जैसे थायराइड है या फिर पीसीओएस है या फिर एक दो और आपने मेंशन किया था, प्रोजेस्टेरॉन का जो सपोर्ट मिलता है प्रेगनेंसी के टाइम पे, उसका अगर इम्बैलेंस है, वो चीजें अगर आप थोड़ा सा और डिटेल में बता सकते हैं कैसे इम्पैक्ट करता है, स्पेशली पीपल, प्रोजेस्टेरॉन तो थोड़ा स्पेसिफिक हो गया, बट पीपल नो व्हेन दे हैव थायराइड और पीपल नो व्हेन दे हैव पीसीओएस टाइप के इश्यूज. तो कैन यू इलैबोरेट अ लिटिल बिट ऑन दैट एज वेल?
So I'll start with basic investigation.
हम्म.
That is thyroid profile.
हम्म.
ये तो सबको everyone will know this, right?
हम्म.
So thyroid is a basal metabolic hormone of the body.
हम्म.
अगर thyroid ठीक नहीं है तो basal implantation ही नहीं हो पाता है.
हम्म.
Even if the basal implantation occurs, it will just go out very soon. So any
हम्म.
kind of thyroid imbalances, hyperthyroidism या hypothyroidism, everything is very important in pregnancy.
हम्म.
So thyroid को normalize करना है. And there is something called prolactin in our
हम्म.
body, which can be increased due to the stress hormones या जो भी है brain की conditions होता है. तो उसकी वजह से भी हमको implantation में बहुत problem आता है. Implant हो पाता है, सही से नहीं हो पाता है. So that is not perfect implantation.
हम्म.
So आधा तक इम्प्लांट कर लेती है, उसके बाद निकल जाती है. So that will lead to the miscarriage, the prolactin levels. So that
ओके.
kind of we can see.
वो पार्शियल
Yeah,
इम्प्लांटेशन इज ऑल्सो अ थिंग,
yeah.
ऐसा नहीं कि इम्प्लांट हो गया तो इट्स ऑलवेज ओके.
Hmm.
गॉट इट. एंड
Yeah, when coming, yeah, this is the hormonal part basically. So blood disorders, and next comes this blood disorders. It's like inherited disorders रहता है, secondary inherited disorders. उसमें बहुत ज्यादा एक चीज होता है कि एप्लास सिंड्रोम, एंटी फॉस्फोलाइपिड एंटीबॉडी सिंड्रोम. तो उसमें क्या होता है कि ब्लड आगे तक आ जाता है, टिप में थ्रोम्बोस हो जाता है,
Hmm.
टिप में क्लॉट बनती है, जिससे ब्लड फ्लो बहुत कम हो जाती है। उसके बाद ऑब्वियसली ब्लड ब्लड फ्लो नहीं है तो अबॉर्शन हो जाता है।
Hmm.
सो दैट इज ऑल्सो रिसेंट इन few years it is like very prevalent.
Got it. ओके
Yeah.
ओके ओके। थैंक यू, आपने काफी डिस्क्रिप्टिव तरीके से एक्चुअली कॉजेज बताए हैं। इट कुड बी वन और द अदर कॉज बिकॉज ऑफ विच मिसकैरेज हो सकता है। तो बट इट्स नॉट लाइक आपकी कोई गलती है या आपने कुछ किया अपने फर्स्ट ट्राइमेस्टर में जिसकी वजह से ये हो गया। मोस्टली इट्स वेरी इंटरनल थिंग दैट हैपेंस, राइट? लाइक एक्सटर्नली वो कितना इम्पैक्ट करता है मिसकैरेज को, द एक्टिविटीज दैट यू डू।
See, that is not very sole reason for the miscarriage.
हम्म
थोड़ा सा इफेक्ट रहता है,
हम्म
but it is not very complete.
हम्म।
Yeah.
ओके
So indirectly, it will cause the miscarriage.
ओके
Yeah.
ओके।
Not
So
everything.
not everything, yeah.
Yeah.
So when we talk about miscarriage की एक बार हो रहा है और जब हम recurrent pregnancy loss को define करना चाहते हैं, is it
Hmm.
like 2 times हुआ and then it becomes recurrent, or is it like more than 3 times हो रहा है and that becomes the definition of recurrent pregnancy loss? How is differentiated between the two?
See, basically, more than three pregnancy losses, it can be defined as recurrent.
Okay,
But we start evaluating from two pregnancy losses.
got it.
Only
Okay.
from two pregnancy losses, because patient will not be ready for the third
Hmm.
miscarriage.
Right.
Hmm.
Okay.
Yeah,
Okay.
only after second. Yeah.
So it's because it's very difficult emotionally and physically to deal with a pregnancy loss, that although medically it's recommended that it's or recommended name, but medically it's considered after 3 pregnancy losses,
Yes.
but start to investigate from the second is
Yes.
itself.
Yes.
Okay, okay. And age factor कितना important होता है miscarriage के केस में?
Yeah, it's very important. Basically, the minimal miscarriage risk is in the age group of 21 to 24.
Wow,
So,
that's
yeah.
really young, huh?
And the second followed by 24 to 29.
Okay.
एंड इसके आगे एंड पीछे जो एजेस होता है ना, उसमें सेल डिवीजन में कुछ प्रॉब्लम आ
Oh,
सकती है. सो इफ
okay,
वी
okay.
गो बैक टू द बेसिक्स, तो
Hmm.
थोड़ा सा माइटोसिस मियोसिस बोल के डिविजन्स रहता है. सो इन दैट प्रोसेस थोड़ा सा
Hmm.
अबनॉर्मल डिवीजन ऑफ क्रोमोसोमल मटेरियल हो सकता है, तो जिसकी वजह से मिसकैरेज हो सकता होता है.
Okay, okay. We already got a question. I wanted to ask you about male factor as well. So we already got a question. Does a male sperm play a role in miscarriage? What is the male factor in fertility? How does that play a role?
यस, इट विल अफेक्ट बेसिकली स्पर्म का जो अभी एम्ब्रियो बनाने के लिए स्पर्म का इट इज वेरी इंपॉर्टेंट, राइट? द
Hmm.
50% विल कम फ्रॉम स्पर्म
Hmm.
एंड ऑल्सो ओवम. सो स्पर्म का जो है,
Hmm.
स्मोकिंग से
Hmm.
स्पर्म का डीएनए जो है
Hmm.
वो डैमेज होने का चांसेस रहता है, जिसकी वजह से मिसकैरेज हो सकता है. सो नाउ इट इज दिस मेल इनफर्टिलिटी एंड विद स्मोकिंग दैट इज वेरी
Hmm.
इंपॉर्टेंट.
Hmm.
इसमें हम एडवाइस भी करते हैं कि स्पर्म डीएनए फ्रैगमेंटेशन, इट इज अ वेरी इंपॉर्टेंट टेस्ट.
Right.
तो इट इज
तो ये
not clinically proven,
hmm.
but it is, some studies have shown very significant relation.
Okay. So,
Yeah.
agar, for example, somebody is or has been a smoker, like a man has been a smoker for a while and they're trying to conceive, and probably or hopefully they stop smoking at least 3 months before they're starting to try. But whatever it is, it would have impacted their sperm. So, is it recommended for them to undergo like a sperm DNA fragmentation, some
No,
kind of test or something? How does it work?
no, not for everyone. Only in the case of recurrent miscarriages, we will advise a sperm DNA fragmentation. इसके स्पर्म
Okay.
एनालिसिस में हमको इफेक्ट दिख जाता है, जो भी है, कमी है या मोटिलिटी कम है या न्यूक्लियर मैच्योरिटी नहीं है, वो सब सीमेन एनालिसिस में थोड़ा सा अंदाजा हम लगा सकते हैं. सो दैट
Hmm.
अकॉर्डिंग टू दैट वी कैन गो विद द स्पर्म डीएनए फ्रैगमेंटेशन इफ रिक्वायर्ड. दैट इज ओनली इंडिकेटेड विद द ओनली रिकरेंट मिसकैरेजेस.
Okay. Okay. तो miscarriage के केस में, for example, when does one decide to see a doctor in terms of, future pregnancy and all of that? अगर miscarriage हो चुका है एक बार, 2 बार, when is it like, now you really must visit a doctor?
So basically, I would advise patients to visit at the first miscarriage only. So basic
Hmm.
investigations, basic workup, जो रहता है ना, सो हार्मोनल टेस्ट, एंड एक रहता है कि रुबेला का
Mm.
इन्फेक्शन इज वेदर दे आर इम्यूनाइज्ड फॉर रुबेला एंड एवरीथिंग. वी कैन जस्ट assess in one go, like very
Mm.
basic test after
Mm.
one abortion. And after second miscarriage, so they definitely they have to visit.
Mm.
And the advantage of coming to the hospital when they are pregnant, अगर मिस
Mm.
अगर हार्ट बीट रुक गई है, लाइक कई लोग आते हैं कि हार्ट बीट रुक गई है,
Mm.
एंड देर इज समथिंग लाइक अबॉर्ट करना ही है, क्लीन करना ही पड़ेगा. सो in that cases na, if they come to hospital, we can send one test with the products of
Mm.
कंसेप्शन. जो भी मिसकैरेज का वो फीटल प्रोडक्ट्स रहता है ना
Mm.
अंदर, वो
Mm.
हम टेस्ट के लिए भेज सकते हैं,
Got it. Okay.
या जेनेटिक एनालिसिस के लिए भेज सकते हैं, जिससे
Mm.
हमको इंफॉर्मेशन मिल जाती है
तो आप
कि
फ्यूचर।
क्रोमोसोम एनालिसिस, यस,
हम्म।
क्रोमोसोम एनालिसिस में हमको कैसा है,
हम्म।
लाइक हाउ इज द फीटस.
हम्म।
अगर बेबी की तरह से कुछ प्रॉब्लम है तो देन इट विल नॉट सर्वाइव.
हम्म।
So in that case, it would be very helpful for the doctor to decide the plan of management for the next pregnancy. That is very important.
हम्म। एक्चुअली जो आपने अभी फीटल एबनॉर्मेलिटी की बात की ना, लिटिल लेट्स जस्ट टॉक अबाउट दैट एज वेल, बिकॉज अ लॉट ऑफ टाइम्स वी टॉक अबाउट एक्सटर्नल और लाइक हार्मोनल फैक्टर्स जो कि इम्पैक्ट कर सकते हैं, बट a lot of times the miscarriages that happen are also because maybe the fetus was not viable, and you would have carried on with that fetus for a long time, and probably have miscarried anyway. तो वो थोड़ा
Hmm.
फीटल abnormality के बारे में भी बात कर सकते हैं क्या?
Yes, fetal abnormality हमको genetic analysis जब हम भेजते हैं ना,
हम्म।
so that we can go ahead. And in the process of IVF, it is very important in that concern.
हम्म।
So basically, we want to introduce a very good embryo with
हम्म।
good genetic material.
हम्म।
सो इन दैट केस पीजीटी करके हमको अच्छा वाला क्रोमोसोम, जो भी जिसका अच्छा है एक्स वाई क्रोमोसोम्स एंड विद 46
हम्म।
क्रोमोसोम्स दैट वी कैन इंट्रोड्यूस. सो दैट इज वेरी इंपॉर्टेंट इन आईवीएफ.
राइट। ओके।
अगर ऐसे नहीं है कि अगर एक अबॉर्शन हुआ है कंपलसरी हमको आईवीएफ में जाना पड़ेगा, ऐसा नहीं है. दे
हम्म।
कैन ट्राई टू थर्ड ऑफ पीपल विल कंसीव नेचुरली आफ्टर लाइक नॉर्मली
हम्म।
विथ दिस काइंड ऑफ प्रॉब्लम्स.
ओके। ओके, दैट्स अ बिट होपफुल. Yeah. I see that there's another question here, that I've recently heard that eating papaya can cause abortion. What are your thoughts on that?
So basically, there is no proven evidence for that. Papaya will cause abortion बोल के,
Mm.
but they say that थोड़ा सा toxins release होता है, inflammatory the ingredients release होता है papaya से, but it's better to avoid papaya.
Mm.
But ऐसा नहीं है कि evidence पूरा clinically proven नहीं है.
Okay. All
Yeah.
right. But maybe अगर
Yeah.
थोड़ा सा भी थॉट है ऐसा तो श्योर अवॉइड.
Yes.
ओके, ठीक है.
Better to be on safe side.
राइट. ओके. एंड recurrent pregnancy loss के केस में, I'm just trying to ask as many questions that I had, but then
Mm.
there are many DMs that we got, and I want to really jump into that, and I want to address the questions that are coming here as well.
Yeah.
But just to cover those few questions that I had is, recurrent pregnancy loss के केस में is surgery an option, and at what stage does surgery play a role?
Yes, definitely it's an option for only few cases
Hmm.
जिसमें यूट्रस में प्रॉब्लम होता है. So there is one condition called septum, uterine septum.
Hmm.
तो यूट्रस के अंदर परत जैसा बना होता है,
Hmm.
मतलब एक रूम पे एक शेल्फ जैसा.
Hmm.
दैट इज नॉट स्ट्रॉन्ग. अगर एम्ब्रियो जाके वहां पे इम्प्लांट हुई तो जल्दी से इट कैन नॉट फिक्स प्रॉपरली.
Hmm.
So in that case, we have to do the septal resection and everything
Hmm.
hysteroscopically. So that surgery we might require for recurrent miscarriages
Okay.
if it is there.
But those, it's very case dependent. It's not like
Case
agar
dependent.
Hmm.
Yes.
Okay.
Yes.
Okay. I see. Okay, there are a couple of other questions. We'll try to address it a little bit in the end also.
Mm.
Uh, और हाँ, आईवीएफ का थोड़ा सा हम लोग रिप्रोडक्टिव मेडिसिन से कैसे सपोर्ट मिल सकता है इन केस ऑफ recurrent miscarriages. That's something that is going to help people conceive and then carry on with the pregnancy.
Yeah, अगर more than 3 miscarriages होता है, so then we will go with this all kinds of investigations, right? So
Hmm.
अगर infertility के साथ में है, miscarriage हुआ है and they started stopped trying and age के हिसाब से miscarriage हो रहा है, so if the patient is like 36 year old and 37 years old, जिसमें miscarriage risk बहुत ज़्यादा होता है and they don't want to take risk anymore,
Hmm.
so that in that case we can go with the IVF.
Hmm.
Associated with PGT, there is something called pre-implantation genetics
Hmm.
testing. मतलब before introduction of an embryo,
Hmm.
so we will do the embryo screening with
Hmm.
PGT. So
Hmm.
then PGT करके अच्छा वाला जो embryo है जिसमें very good genetic material हो and exact number of chromosomes हो, तो उसको लेके we can screen and we can introduce in the patient.
Okay.
That in
So,
that case we can use. एंड
okay.
एक और भी रहता है कि एंटी डी में बहुत सारा अबॉर्शंस हो गई हैं एंड मेनी टाइम्स एंड mother's body is not responding to the positive blood group of fetus, then we can
Hmm.
go with the IVF. With that too with donor one. Yeah, that is a very rare case. But
Great.
you can just try with this. Yeah.
Okay.
Only old age. Yeah. So if the patient is very young, we'll give the chance.
Hmm. Okay.
एंड या सो क्रोमोसोमल कैरियोटाइपिंग टाइपिंग भी करना पड़ेगा पेरेंट्स का. सो इफ इट इज क्वाइट नॉर्मल वी कैन गो अहेड विद नॉट नेचुरल.
Hmm.
अदरवाइज इफ एनी डिफेक्ट इज सीन इन कैरियोटाइपिंग या जो भी है, सो वी कैन गो विद आईवीएफ. स्पेशली पीपल विल कम विद थैलेसीमिया या जो
Hmm.
एनी डिसीज ट्रेट
Hmm.
in the parents, they don't want to introduce into the baby,
Hmm.
that in that case also we can go with the IVF
Got it.
associated with this recurrent miscarriages and everything. Yeah.
So then the benefit there is that you get the genetic testing before the embryo is transferred, and that kind of helps transfer the right kind of embryo with the.
Yes,
Okay.
exactly.
Okay. But does that also help in successful implantation and carrying on with a successful full-term pregnancy?
Yeah, definitely it will help.
Okay.
जिसमें क्रोमोसोमल इम्बैलेंस होता है तो उसमें तो पक्का उनका इफेक्ट रहता है, मतलब
Oh,
इट विल हेल्प
okay.
100%. या.
Okay. Great. Amazing. ओके, हमने जेनेटिक इश्यूज के भी बारे में बात कर ली है, पीसीओएस के बारे में बात कर ली है. सम काइंड ऑफ प्रीनेटल केयर अगर हम करते हैं, जैसे फॉर एग्जांपल जस्ट टेकिंग प्रीनेटल विटामिन्स ऑन टाइम, या कोई भी और प्रीनेटल केयर जो लोगों को करना होता है, अगर पीपल आर नॉट डिलिजेंट विद दैट, लाइक स्पेशली वुमेन आर नॉट डिलिजेंट विद दैट, डज दैट आल्सो लीड टू possibility of recurrent pregnancy loss or miscarriage? Does
Yes,
that impact at all?
definitely, vitamins are the basic ingredients, right?
Hmm.
So for the body and fetus formation या जो भी implantation होता है सबके लिए basic metabolism के लिए vitamins required होता है. So every vitamin is important, and in these cases, I've seen folic acid deficiency and vitamin D deficiency in recent days. So we
Hmm.
can supplement the patients with the vitamin D and also folic acid prior.
Right. Okay.
Yeah.
So
Yeah.
then that it means it does have a huge impact
Yeah.
in the. Okay.
Hmm.
Okay. Got it. And after a miscarriage, how soon can one start trying for pregnancy again?
At least 2 months.
At least 2 months.
At least 2 months.
Okay.
And there's also we need to categorize the miscarriage if it
Hmm.
happened within like 14 weeks या 14 to 20 weeks.
Hmm.
तो 14 weeks के अंदर क्या होता है या 14 weeks के बाद कैसे होता है. So if the gestational age is higher, fifth month, so
Hmm.
it takes the body to get into the normal state quite longer than usual period. So in that case, probably like 3 months.
Hmm.
Yeah.
Okay. Okay. तो फिजिकली बॉडी रेडी हो जाएगी, बट इट्स ऑल्सो सच अ mental challenge for women and also for the couple to go through it. How does one deal with this process emotionally?
So support, family support, that is the only thing we can help, and doctor support also.
Hmm.
And
Right.
from patient side also, they have to come out of all that stress and everything
Right. So
by diverting. Yeah,
Okay.
the
So,
exercise, the yoga, and maintaining the mental stability and everything.
right.
Yeah,
So maybe
there's
the
a
right
lot more counselors.
Right.
Yeah,
And it's good to kind of also talk about it because it's such a like a private sensitive topic that you need to kind of find the right people that you can reach out to talk to. Like अपने doctors के साथ ही अपने gynecologist से बात करके figure out कर सकते हो if
yes,
you know they can recommend somebody to you or some a few exercises or like meditative or breathing, whatever supports
yes.
you and helps you distract from this process and get, you know, overcome this difficulty. But yeah, something that needs to be addressed. अगर हम एक सिर्फ जेनेटिक एबनॉर्मेलिटीज की बात कर रहे हैं, हार्मोनल इम्बैलेंसेस की बात कर रहे हैं, रेकरेंट प्रेगनेंसी लॉस अगर लोगों को 5 या 6 बार हो रहा है देन दे लूज होप कि इसके बाद प्रॉब्ली नहीं हो सकता है इवन इफ दे हैव लाइक गॉन थ्रू अ लॉट ऑफ अदर प्रोसेसेस एज वेल मे बी दे हैव गॉन थ्रू आईवीएफ एज वेल डू यू थिंक देयर इज स्टिल होप देयर
Yes, there is hope. Like two-thirds of people will conceive even after six miscarriages. That's proven thing. With
okay
IVF, with proper treatment. मतलब
right
every other cause is to be treated.
okay
Everything from all other sides. जो भी factor आ रहा है उसको सबको treat करके हम we can just find out the solution somehow. And
okay
two-thirds of people, yeah.
that's very promising to hear that even if after 3, 4, 5, 6 miscarriages, if there is still
Mm.
hope with, of course, assisted reproductive technology, which is something that is coming to our benefit and it's coming to our aid. So, you know, something that we can explore. कई लोग काफी
Yes.
घबरा जाते हैं सोच के IVF कराने के लिए, but in cases में I think it's such a boon
Mm.
to also, you know, go ahead and we have a successful pregnancy with the technology and scientific advancements that we have made.
Yeah.
So thanks for giving those data because I think काफी लोगों ने जिन्होंने उम्मीद छोड़ के रखी है उनके लिए काफी you know it's very promising to hear this.
And there are many invasive techniques now. So
Hmm.
microsomal array and genomic hybridization and
Hmm.
fishbowl के एक और है. So they are
Hmm.
coming up with a new kind. Fetal medicine is also very fetal medicine and ये genetic जो counseling part होता है
Hmm.
या genetic test होता है. So they are like evolving right now.
Hmm.
So they are come into the market recently. So we can make use of them.
Okay, perfect,
Yeah.
great. आई एम हैप्पी कि हम डिफिकल्टीज की बात कर रहे हैं बट ऑल द टाइम वी आर कमिंग बैक टू लाइक अ होपफुल थॉट कि यू नो थिंग्स आर स्टिल पॉसिबल इट्स स्टिल पॉसिबल इवन आफ्टर मल्टीपल मिसकैरेजेस टू बी एबल टू कंसीव वी जस्ट नीड टू फाइंड द राइट treatment option that are
Yes.
available. I can see that somebody has asked, and I'm just not mentioning their name to, you know, have the anonymity of the person. Um, HCG role in miscarriage. What is the role of HCG in miscarriage?
HCG role मतलब investigation wise or what do you want to tell? Injection wise, treatment wise.
That's
So
the question that was given.
yeah,
So interpret it the way you want and give us an answer, maybe.
so
And if
miscarriage
you,
diagnosis. Yeah, so diagnosis के लिए हम बीटा HCG यूज कर सकते हैं if it is a failing miscarriage or something. बीटा HCG fall होता है तो that is like investigative purpose. And HCG injections होता है. तो
hmm,
first
hmm,
trimester में we can give
hmm.
first trimester.
Okay, they would,
First 3 months में yeah. So
they,
it only works for 10
हाँ,
weeks basically.
उन्होंने लिखा है वो HCG इंजेक्शंस की बात कर रहे थे.
Yes. For 10 weeks we can give the injections that will support the pregnancy. That will do the अगर naturally हमने try किया है. So
Hmm.
then naturally हमारे body पे corpus luteum बनता है ना तो वो
Hmm.
फूटने के बाद. So that will release HCG.
Hmm.
So in that natural process we are stimulating from outside
Correct.
HCG injection. Definitely it will help.
Hmm.
Any kind of progesterone support also will help. It's not like HCG has to be given.
Right.
Yeah.
Okay. Okay.
Progesterone also can help.
Okay. So this
Yeah.
or that either or would
Mm-hmm.
work. Okay. Okay, great. Let me just quickly see this. I have some questions over here also. Um, And please pour in more questions in the नीचे right hand side corner में there's a question mark. वहाँ पे आप अपने questions डाल सकते हो. If it's difficult for you to find that question mark जहाँ पे tap करना है, you can write it in the comments. I'm already addressing some questions from the comments also. Let's utilize the opportunity of Dr. Shraddha being with us today. Okay. So, Dr. Shraddha, somebody has asked if someone has tried IVF 4 times, but every time in later stage miscarriage is happening, what could be the reason? I think we briefly addressed this as well. In fact, in very much detail, we've addressed this already. Is this?
So later stages, we need to evaluate regarding cervical integrity also, 14 to 20 weeks.
Hmm.
And also all other thrombophilia screening, blood disorders का screening भी करना पड़ेगा.
Okay.
And all other factors, any other, rest all. So,
Right.
like regular investigations with along with cervical integrity, incompetence का जो होता है, तो उसकी
Hmm.
वजह से भी abortion होने का chances रहता है. तो that
Hmm.
also we have to check in the later stages of miscarriage.
Got it. Okay. And there's someone else who's asking, can we walk for more than 20,000 steps after IUI treatment? That's part one of the question. And can we
Yes.
travel long distance after 1 week of IUI treatment? I think the question is pertaining from the perspective of miscarriage to nahi ho jayega if I am involved in these kind of activities. What do you think?
So if it is the first IUI, we can definitely matlab, reduce that to 10,000 steps.
Hmm.
So long journey, it will not cause as such कुछ miscarriage होने का chances तो नहीं रहता है, but we can wait and watch. ऐसा नहीं है कि कुछ नहीं हो जाएगा, but we have to be on the safer side. We can travel. Yeah,
Hmm. So it's
we can
allowed to
travel.
travel, but just
Yes,
be vigilant of the fact that,
yes. Any kind of warning signs, spotting, या कुछ भी bleeding दिख रहा है, then we have to be very alert about the warning signs.
got it. Okay.
Yes.
Okay. Okay. You still have the opportunity to write in your questions. Thank you, Dr. Shraddha. आप बहुत ही अच्छे से डिटेल में हमें आंसर्स दे रहे हो, एड्रेस कर रहे हो हमारे क्वेश्चंस को. There are many questions that I have here from the DMs. So I will just start asking those questions as well.
Yeah.
So there's a person, a woman who asked, मेरा पहले miscarriage 8 weeks पे हुआ था, दूसरा 6 weeks पर. हर बार प्रेगनेंसी और जल्दी लूज हो रही है. क्या इसका कोई रीजन हो सकता है? और मुझे बार बार प्रेगनेंसी के कुछ वीक्स तक सब नॉर्मल लगता है, फिर एकदम से ब्लीडिंग स्टार्ट हो जाती है और मिसकैरेज हो जाता है. इसका कोई परमानेंट सोल्यूशन है क्या?
Yes, definitely. But she has to get the test done when in the non-pregnant state after 6 weeks of at least 6 weeks of abortion. So all the blood tests, all the sugar levels, prolactin levels, thyroid levels, and Aplas syndrome, मैंने जो बोला था,
हम्म.
thrombophilia screening,
हम्म.
and chromosomal karyotyping,
हम्म.
that all needs to be done. So
Okay.
if we find any kind of problem in that, we can just keep treatment accordingly.
Okay. But
Yeah.
it is possible to kind of detect and then find a permanent solution for something like this as well.
Yes,
Okay.
yes. But thorough evaluation is to be done.
Thorough evaluation, but possible है.
Yes.
But it has to be a detailed thorough evaluation. Okay. Uh, मुझे पहले मिसकैरेज के बाद प्रोजेस्टेरॉन दिया गया था, लेकिन फिर भी दूसरा मिसकैरेज हो गया. क्या मुझे ये मेडिसिन अगली प्रेगनेंसी में फिर से लेनी चाहिए?
लेनी चाहिए. Progesterone support is like minimal for the recurrent pregnancy loss.
Okay.
But all other factors is to be evaluated again.
Oh,
Progesterone support is mandatory.
okay. Can you
Mm.
explain a little bit so that people just don't have the question कि मुझे ये मेडिसिन दी गई है मैं ले लूं, मैं उन्हें थोड़ा समझ में आए कि क्या करता है प्रोजेस्टेरॉन सपोर्ट बॉडी के लिए, जब आप ट्राई कर रहे हो प्रेगनेंसी के लिए, मिसकैरेज को कैसे वो मे बी प्रिवेंट तो नहीं, मे बी, बट लाइक इट्स जस्ट सपोर्टिंग योर
It
बॉडी इन
supposed
ऑर्डर
the
टू बी प्रेग्नेंट.
implantation basically. It supposed the implantation. So proper fixing के लिए help करता है. So we can overload the progesterone also in pregnancy. कुछ problem नहीं होता है. Basically all the IVF pregnancies also जिसमें हम technical अगर artificial implantation कर रहे हैं, तो that will need progesterone support. And जिसमें अगर luteal phase defect बोल के एक चीज रहता है PCOS में, So
Hmm.
progesterone levels are lower in that.
Hmm.
Naturally, progesterone levels are lower in that.
Hmm.
In that case, it will be very helpful.
Hmm. Okay. Okay. तो नॉट जस्ट कि प्रोजेस्टेरॉन दोबारा लेना चाहिए कि नहीं लेना चाहिए, वो तो एब्सोल्यूट लाइक इट्स अ मैंडेटरी कि वो
Yeah,
लेना है, बाकी
definitely. And it's
फर्दर
no harm in taking progesterone.
राइट
The side effects of
इनफैक्ट
progesterone in pregnancy is very low. मतलब
ओके
आपको कुछ प्रॉब्लम नहीं हो जाएगा unless and until it goes to very high doses.
ओके ओके सो इट्स मोर लाइक, हाँ मतलब इन उनकी पहली प्रेगनेंसी, पहले मिसकैरेज में प्रोजेस्टेरॉन के बाद व्हाटएवर उनका दूसरा मिसकैरेज भी हुआ था, एंड देन लाइक अब मैं फिर से लूं कि नहीं, उसका क्वेश्चन इज नॉट रियली वैलिड इन दैट सेंस, बिकॉज इट्स नॉट द प्रोजेस्टेरॉन जिसकी वजह से कुछ भी हुआ होगा, इट्स ओनली सपोर्टिंग योर इम्प्लांटेशन एंड एवरीथिंग, तो ये तो वन ऑफ द बेसिक थिंग्स दैट यू हैव
Yes.
टू कंटिन्यू टेकिंग।
Hmm.
ठीक है। उन्होंने अनदर पर्सन हैज मेंशन दैट मुझे क्लॉटिंग डिसऑर्डर है और पहले मिसकैरेज हो चुका है, क्या मुझे अगले प्रेगनेंसी में ब्लड थिनर्स लेने चाहिए?
Definitely. अगर if so we will screen for the biogenetic biochemical and genetic analysis of the like recurrent pregnancy loss के लिए एक पैनल रहता है बेसिकली।
हम्म।
उसमें बायोकेमिकल इन्वेस्टिगेशंस रहता है एंड ऑल्सो जेनेटिक इन्वेस्टिगेशंस रहता है।
हम्म।
सो उसमें कौन सा फैक्टर है, एक चीज रहता है कि थ्रोम्बोफिलिया।
हम्म।
So any thrombophilia, yeah, homocysteine levels are high, and this kind of this aplas, मैंने जो बोला है, which is very
हम्म।
common. So in these all cases, that heparin is to be given. Blood thinners, yeah.
ओके। तो जैसे उन्होंने बोला मुझे अगले प्रेगनेंसी में ब्लड थिनर्स लेने चाहिए क्या, बट ये सेल्फ प्रिस्क्राइब
So
लाइक सेल्फ
no, 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 no.
हाँ।
It's always under doctor's supervision. We just have to see the all the reports of her, and it should be proven,
हम्म।
and then only we can start.
राइट।
अगर
ओके।
पेशेंट का अगर क्रोमोसोमल एनालिसिस में कुछ प्रॉब्लम हो रहा है तो हेपारिन लेने की जरूरत ही नहीं पड़ती है।
हम्म।
देन देयर इज नो पॉइंट इन, अगर क्रोमोसोमल एनालिसिस में डिफेक्ट है उसको करेक्ट कर लो, अगर हेपारिन देने से कुछ भी नहीं होता। सो वी हैव टू बी एवेल्युएटिंग द केस, इट्स अ केस स्पेसिफिक।
गॉट इट।
अगर पेशेंट को ये इससे बेनिफिट हो जाता है कि नहीं, ये देखना पड़ेगा।
ओके। ओके। सो अनदर क्वेश्चन इज, मेरा मिसकैरेज नेचुरल हुआ है, मुझे डीएनसी करवाना पड़ा, क्या बार बार डीएनसी करवाने से फ्यूचर प्रेगनेंसी में कोई इफेक्ट पड़ेगा?
मतलब very mild effect. Basically, every gynecologist, any gynecologist will do gentle DNC. It's not like very hard on uterus or
हम्म।
something. We'll do gentle curettage on the uterus. So
हम्म।
there, but there are very mild chances that they could undergo this intrauterine
हम्म।
adhesions and everywhere, and that can cause the trouble to the patient. It can cause infertility. इम्प्लांटेशन में डिफेक्ट आ सकते हैं, दैट वो भी लाइक लॉन्ग टर्म में आ सकती है, बट वेरी लेस केसेस।
गॉट इट।
या
ओके।
अनलेस एंड अनटिल वेरी एंडोमेट्रियम बहुत ज्यादा खराब हो गई है, देन इन ओनली दैट केसेस वी कैन वी इंट्रायूटेनाइजेशन जाने का चांसेस रहता
Okay,
है।
got it. Everybody who's joined in, I see a lot of people has joined in today. तो please utilize the platform. अपने questions डालते रहो either comment section में या फिर question mark section right hand side bottom पे जो है. I can see somebody else has asked a question. Pregnancy में सबसे cautious duration कौन सा होता है trimester wise?
First trimester and third trimester. Second trimester is always safe.
Okay. In what
Yeah.
respect थोड़ा सा और can you describe?
What मतलब see, and exercise wise या safety wise, in
हम्म।
what sense?
Like miscarriage के terms में आज हम लोग बात कर रहे हैं, तो
First trimester, definitely.
हम्म।
Yeah,
Okay, first trimester.
yeah.
Okay, so what are these cautions that we're talking about? Should they be looking out for some signs that indicate that there is a potential like difficulty in the pregnancy or potential miscarriage type की चीजें, या फिर in general what are the general cautions that people can take during the first trimester to make sure that there is no pregnancy loss, hence future may also there is no recurrent pregnancy loss?
So that first trimester में आपको we can talk about lifestyle modifications also,
Hmm.
restriction of alcohol, caffeine, and stress, and
Right.
heavy exercise, only moderate amount of exercise, and avoid like in these days deep diving and everything is happening, right?
Hmm.
So deep diving is not recommended now.
Hmm.
So that will cause more of pressure changes.
Hmm.
And any kind heavy exercise is not indicated. They can go to gym, they can do moderate amount of exercise, not heavy.
Got it.
Yes.
Okay.
And we can talk about abstinence also in first
Hmm.
trimester. Yeah.
It's
And
recommended.
infection, yeah, we need to take precautions for the preventing infections also, vaginal infections or urine infections. That also might cause miscarriages.
Okay.
So simple kind of urine infection also can cause the miscarriage.
Got it.
Yeah, so that we have to keep it in the mind.
Okay.
Genital
Okay.
hygiene and everything.
All right. Okay. um so somebody else, उन्होंने लिखा है कि मेरे मिसकैरेजेस आईवीएफ प्रेगनेंसी में हो रहे हैं, तो क्या आईवीएफ प्रेगनेंसी में मिसकैरेजेस का रिस्क ज्यादा होता है? We've kind of
No, it's
addressed
not.
this, but हाँ.
Yeah, इट्स नॉट वेरी प्रूवन सी.
हम्म.
आप जो बाहर हो रहा है तो अंदर हम वही चीज करेंगे कि जेनेटिक मटेरियल तो सेम ही डाल रहे हैं.
हम्म.
सो शायद इम्प्लांटेशन का प्रॉब्लम आ सकती है.
हम्म.
अगर हमने इंट्रोड्यूस करवाया है एम्ब्रियो एंड probably uterus might not be responsive at that time, that might be the implantation failure.
हम्म.
मिसकैरेज रिस्क सेम रिस्क रहता है जो भी
हम्म.
नेचुरल प्रेगनेंसी में हो रहा है. तो मैटरनल का हमको क्या रिस्क है, फीटल का क्या रिस्क है, क्रोमोसोमल एबनॉर्मलिटीज, इट्स सेम एज नो नेचुरल.
तो
Very
then
mild
again,
risk, because it is not sole reason for that.
okay, तो again this is case dependent and it's also something क्योंकि हम जब आईवीएफ भी कर रहे हैं, the natural process of the first 5 days that happens inside the body is just happening outside the body.
Yes,
बाकी
yes.
everything is the same, right?
Same.
हाँ, just कि हम हॉर्मोन्स को इग्नाइट कर रहे हैं
Huh.
artificially, but everything is happening in the natural process that it does usually.
Yeah.
Hmm.
But we have to know why the patient has undergone IVF also. There will be suboptimal factors which can be corrected. So the reason for the infertility, what is
Hmm.
the reason for infertility? That might be the indirect cause for the miscarriage in IVF. So
True.
that age के हिसाब से
Hmm.
आपको egg का quality अच्छा नहीं है.
Absolutely.
So miscarriage होने का chances obviously होता
Right.
है. But if you take the young patient and which has no problem उतना नहीं है, and unknown fertility, idiopathic fertility है, which has
Hmm.
no reason and everything, then the almost the miscarriage um, prevalence is same almost.
Got it.
Yeah.
Okay. Okay. Yeah, we still have like another 10 minutes, 10 to 12 minutes. So you can ask your questions. You can keep pouring in your questions. I have a couple of more questions that were in our DMs. तो मैं वो अभी पूछूंगी. इस बीच में अगर आपके पास और भी questions हैं, please just type in and ask your questions. And if there is something that needs a bit more detailed discussion, which is like very case dependent, so Dr. Shraddha is also available with us to provide, consultation for you. Currently, our consultations are free of cost, so feel free to avail that for as long as that is going to last, and we'll try to help you out as much as we can. ओके, सो द नेक्स्ट पर्सन, इन्होंने बोला है कि मुझे एंडोमेट्रियोसिस है और मुझे 2 बार मिसकैरेज हो चुका है, तो इन दोनों का कोई कनेक्शन है क्या?
See, it's not the sole reason for miscarriage. It might be the reason till some extent, not like 100%. It is a reason for pregnancy loss.
Hmm.
So we'll just usually evaluate like any other normal case,
Hmm.
but it's not very specific to endometriosis.
ओके. ओके.
इम्प्लांटेशन फेलियर होने का चांसेस रहता है. बेसिकली इम्प्लांट दे हिंडर द इम्प्लांटेशन एंडोमेट्रियोसिस वाला.
ओके, बट इम्प्लांटेशन तो बहुत ही अर्ली स्टेज में होता है, तो लाइक मिसकैरेज तक
यस.
पहुंचना विच वुड मीन दैट इम्प्लांटेशन ऑलरेडी हो चुका है बट वो सक्सेसफुली
यस.
ट्रांसफॉर्म
यस.
नहीं हो पाया. सो अगर इम्प्लांटेशन फेलियर हो रहा है, दैट्स वेयर endometriosis plays a bigger role compared
बिगर
to
रोल, या
actual.
एग्जैक्टली.
Okay.
बट मिसकैरेज में भी थोड़ा सा रोल रहता है, बट इट्स नॉट क्लिनिकली वेरी मच प्रूवन.
So it could be like the other factors that are impacting, and endometriosis
यस.
could be an accompaniment to that. Okay.
सो बेसिकली वी नीड टू evaluate all other causes also. It's not like endometriosis से ही ये होता है, हम कंक्लूड नहीं कर सकते.
Okay. ओके। मेरे अल्ट्रासाउंड्स नॉर्मल होते हैं, ब्लड टेस्ट भी नॉर्मल है, फिर भी मुझे बार बार मिसकैरेज हो रहा है। अगर सब रिपोर्ट्स ठीक हैं तो प्रॉब्लम क्या हो सकती है? नाउ दिस हैज टू बी वेरी केस डिपेंडेंट, बट आई डोंट नो
Yeah.
कैन।
So we need to see the how the investigations are and whether everything is done properly or not.
हम्म।
So according to that only we can decide.
ओके। So in that case, I
Yes.
would probably recommend that you send us a DM, you share our reports with
Yes.
us, and then personally, हम reports देखेंगे. Doctor, you will undergo this whole trying to diagnose कि क्या issues हैं, and then it's easier to kind of detect कि main problem क्या है, because this is a
Yes.
very generic um, thing to say कि बार बार हो रहा है, उसका reason क्या हो सकता है? Reasons तो हमने अभी पूरे लाइव सेशन में काफी बार डिस्कस किया है, तो यस। मुझे पहली प्रेगनेंसी में जेस्टेशनल डायबिटीज था, फिर मिसकैरेज हो गया। क्या डायबिटीज मिसकैरेज का एक रीजन हो सकता है?
हो सकता है if the HbA1c is very अगर sugars और बहुत high
हम्म।
है and that will cause malformation in the baby.
हम्म। ओके।
Abnormal parts होना ये सब होना and if the baby is not well enough to implant inside the uterus and it will obviously it will lead for the pregnancy loss. And it plays a very big role. HbA1c is also part of investigations which decides sugars for the last 3 months कैसा है sugars कैसा है वो हम advise करते हैं patients को. That is very much so important.
ओके।
Yeah.
Let me, I can see one more question. I think maybe this would be the last one. um oh, sorry, I'll just disconnect this one. Yeah. So, okay, this is more an addressing the emotional aspect of the whole process, because so she's saying that I have undergone four miscarriages, and with the fifth miscarriage was after I got my IVF done. And so I do not have, now that I see children, it's difficult for me emotionally to handle situations when I'm going out for shopping or something, to see kids around. And I really want to be able to conceive and have another child, but I don't have the mental capacity uh, to be able to, you know, um, conceive again and then miscarry again. How do I handle this situation?
See, in this case, it's very important for the counseling part.
Hmm.
पेशेंट को अच्छे से टाइम देख के हमको काउंसलर करना है एंड देर इज वन डिपार्टमेंट इन रिप्रोडक्टिव मेडिसिन बेसिकली साइकोलॉजी पीपल एंड हु स्टडीज द साइकोलॉजी एंड एवरीथिंग अबाउट देयर मेंटल स्टेटस एंड एवरीथिंग तो उनसे काउंसलिंग प्रॉपरली होना चाहिए एंड दे हैव टू मीट द प्रॉपर डॉक्टर एंड like yeah metro cities में so it is not impossible yeah it's very much possible they have to come to the right center and at the right time it will happen see we are staying in this 21st century right so everything has a solution
Yeah.
yeah
It's difficult to kind of also undergo this whole process, because after a point, there is a feeling of giving up. I have spoken to a lot of women who have been undergoing, several miscarriages, and one thing is कि possible है कि नहीं, and the other thing is am I ready and available to get my body to go through another of those miscarriages, and that overcoming that barrier is also a very huge barrier. So that emotional support, that right kind of guidance is very important. For the person who's asked this question, I would urge you to send us a DM,
yes
and
yeah we'll definitely counsel you
and let's sit together, let's talk about it, and you don't need to be ready right away. That's not
hmm.
what is important. It's important to give yourself some time. This is not easy, but we also want you not to lose hope, because as Dr. Shraddha, in every few minutes we were discussing that with every kind of situation that has come in, there is still some hope. तो कुछ सोल्यूशन निकल सकता है. You just need the right kind of guidance, you need the right kind of counseling. तो now we would love to help you with this, so please get in touch with us, just send us a DM and we'll try to address this and work on this together. Okay. Okay, I see one more question, so I'll just see this. If mother has diabetes mellitus, then is it transferred to baby? Does it transfer to baby?
Yes. So there are two types of diabetic, type 1 type 2, उसमें ना
Hmm.
अलग अलग डायबिटीज का
Hmm.
टाइप्स होता है. So type
Hmm.
1 is definitely inherited, तो
Hmm.
genetic component होता है. And yeah, type 2 is also sometimes inherited to the baby in later stages of life.
Mm-hmm.
Yes.
Okay, so it does.
Mm.
And is there
Yes.
any way to kind of prevent that from happening, or what can one do?
Lifestyle modifications.
Okay, so
Yes.
lifestyle modification pre pregnancy की आप बात कर रहे हो फिर?
Yes, yes, yes. So maintain proper BMI, maintain proper sugars, regular checking of
Hmm.
sugars, and taking the supplements, folic
Hmm.
acid, and everything that
Hmm.
on time will help.
Okay. So basically, lifestyle factors will impact the future pregnancy that you have. जो आप
Yes,
pregnancy के
yes,
पहले अपना
yes.
ध्यान रखते हो, जो
Mm,
preconception आपका
mm,
lifestyle है. Okay. But
mm.
then the answer to the question is, if we have to be direct, कि अगर diabetes है और तो it does transfer to the baby.
Yes.
Okay. Okay. Great. I don't see any more questions. Okay. Perfect. ठीक है. If you are not able to think of a question right now and you still have something in your mind that you want to talk about, if you want a consultation with Dr. Shraddha or any of our other doctors who also specialize in reproductive medicine specialists, and they have their own, super specializations as well. So, we'll get you in touch with them, and आप बात कर सकते हो, अपनी प्रॉब्लम्स डिस्कस कर सकते हो, शेयर कर सकते हो. एंड चाहे आपको मेडिकल गाइडेंस चाहिए हो, चाहे इमोशनल सपोर्ट चाहिए हो, वी आर हियर ऑन दिस जर्नी विथ यू, एंड आवर एम इज टू हेल्प यू in whatever capacity we can to be able to conceive. So, on this journey together, Dr. Shraddha, I'm really happy that you joined us and helped us with addressing so many questions and answering them to help people out.
Thank you.
Mm.
It's very
To
always good to
Yeah,
have with
yeah.
you.
And to end the session, अगर हम I don't know किसी hopeful note पे end करना चाहते हैं, which you've given a lot of hopeful bits here and there. Is there anything that you want to conclude with?
See, yeah, I want to conclude with like for the people who are suffering with the genetic problems, yeah, baby में कुछ problem हो रहा है, so they are like very restricted with this IVF kind of taboo.
Hmm.
IVF is not good, so but better they have to come to the IVF centers,
Hmm.
proper IVF center, and
Hmm.
get all this tests done, whichever are like very recent,
Hmm.
and then take very good help. Like we can, they can use that to the 100%, and they can conceive,
Right.
not by
Okay.
wasting time. And there are very good investigations now, so which
Okay.
have come up in the 2000 say.
Hmm.
So earlier it was not there.
Okay.
So right now like, they're very good time lapsing imaging का जो stages of formation होता है
Hmm.
IVF में.
Hmm.
So with that now we can recognize what is which is good embryo, which is doing well,
Hmm.
so that we can see it in time lapse imaging. So they're like very helping. The AI is
Hmm.
coming up, and
Hmm.
with that now we can use of we can make the treatment smoother and pleasant experience.
Right.
Just
So this taboo
with the right
around
doctor. Yeah.
Correct, right. So the taboo around or the fear around IVF is something that we need to take away from the whole process, because it's only going to help and aid and assist us in furthering the pregnancy, so to say. Yeah, is that
Yeah.
what yeah.
Yes.
And just because you've just addressed this, and I know we were going to wrap up the session, but एक follow-up question आ गया है. At what stage should one decide to go for like अगर multiple pregnancy loss है, अगर recurrent pregnancy loss है तो किस stage पे उन्हें decide करना चाहिए कि I should go for an IVF. Should they wait for the doctor to recommend this? Should they decide it on their own कि नहीं एक miscarriage हो गया, I will straight away go to IVF, or what is that right time?
So when the age is more, 35 years or more, definitely we will only recommend. So only doctors will recommend कि आप जल्दी से IVF कर लीजिएगा. So that will be helpful to you rather experiencing more miscarriage loss.
Right.
So and it is also case dependent as I told you. अगर recurrent pregnancy loss का reason अलग होता है तो हम IVF से treat कर सकते हैं तो कर सकते हैं. Otherwise we have to correct the all other factors which are causing the recurrent pregnancy loss.
Okay.
Yeah.
Okay, perfect. Okay, thank you so much for addressing that as well. I'm really happy it was an interactive session. We addressed a lot of questions. You still have any questions, you can always send us a DM. You will address your questions, answer your questions, or if you want a consultation, you can always book a consultation online by sending us a DM, and we're here to help you. Truly, I think today with the topic of multiple miscarriages, we did try to find some support, but most importantly, try find some hope that in any and every situation, there is still a chance for you. चाहे वो reproductive assisted technology के through हो, चाहे वो natural conception के through हो, there's a lot of solution and hope in every situation. So thank you, Dr. Shraddha, for giving us that ray of hope, and we hope that we were able to help a lot of people over here.
Yeah.
All right. See you around next time, everyone. Bye bye.
Thank you, everyone.